Good morning, everyone, and welcome to this week's edition of Coalition Conversations. For those who don't know me, my name is Fiona Kyle, and I'm the CEO of Mental Health Reform. Mental Health Reform is Ireland's leading national coalition on mental health. We are a membership-based organisation and we have 75 members who represent a diversity of interests, including children's rights, disability, homelessness, human rights. What we do is we bring together our members, all of whom are dedicated and are working in their own way towards reforming Ireland's mental health services. So we provide a platform where we speak with one strong voice to policymakers, to decision makers. We campaign publicly. We identify areas that need particular research and carry out a lot of our own research. So this is a conversation, and as I say every week, please do get involved. If you're on Twitter, use the hashtag Coalition Conversations. So for Mental Health Reform, it's been another very busy week since we had our last conversation. Yesterday we had our AGM. So like everyone, our AGM this year was virtual, and it went really well, and our members participated from across Ireland, which was wonderful to see. We've also been busy talking to our new government and our opposition. So I was earlier this week speaking to the Sinn Féin spokespeople on mental health and health respectively. So it was great to kind of raise the concerns of the sector with Deputy Culnan and Deputy Ward, and to see how we can work together with them as well in their key role as Sinn Féin spokespeople. We've also been busy analysing the new mental health policy, sharing the vision, and we will be publishing our analysis of that document in the coming weeks. So for those who are interested, do keep an eye out for that. And then I suppose on to the main business of today, which is of course the conversation that we're looking at. We're looking at the area of employment. And this is something that mental health reform has been a key priority for us for many years. So we're all aware that within the different disability groups, those living with mental health have the highest rate of unemployment. And when we compare this to what I suppose is written in policy documents and is written in best practice, which really sees the real benefit of people living with mental health difficulties in entering the workforce, and that it can be for some, it can be a key part of their own recovery process. So mental health reform has been very much involved in the initial kind of establishment of the individual placement support program, the IPS, which we will hear a lot more about today. But I think it's important, we hear so much discussion on COVID and its implications for employment more generally. And we've made huge strides. These programs which you're going to hear about today are really innovative, and they've been really, moving things forward in the area of employment and mental health. And we just want to discuss that today and, look at kind of the implications and the next steps as well, and how we can ensure that momentum that's there, that we continue it, and that we're really assisting the needs of people, and we're assisting them in their own communities. So I'm just going to hand over now without further ado to our first speaker. Just to say, if people want to ask questions, Jane can't stay for the duration of the webinar, so we're going to have a Q&A specifically for her afterwards. So if you have questions or comments, please use the question box or the chat box. So without further ado, our first speaker, I'm glad to introduce is Jeanne McDonagh, who is the CEO of Open Doors Initiative. So over to you.
Thank you very much. I always have to do a quick check to see if my washing is hanging behind me, so apologies. I started this piece doing what in hindsight was a rather dry tour of the Open Doors Initiative and of who we are and what we do and stats and graphics. But it's kind of evolved into more of a personal reflection on mental health and working. So I hope it's of use on a personal level and on a practical level as well. So I'm the CEO of the Open Doors Initiative, and we work with a large number of companies and NGOs and government, including the mental health reform, to help marginalised people find employment. And this includes refugees, asylum seekers and migrants, disadvantaged youth, and people with all disabilities, including mental health, and any intersectionality there in between the groups. I also happen to have a mental health diagnosis, which is dysphoric elation, which is a type of bipolar, bad highs and bad lows. And I've had that since I was 15. And it's an invisible disability in that I'm lucky in that I wear it lightly. I've got treatment. I'm on up to 8 tablets a day and other supports to manage it. And ever since my diagnosis, I've always been very open about my illness personally and in work. And I never, for example, referred to myself as I am bipolar. I would say I have bipolar. And to use medical terminology, it's a disease, and I don't want to be owned by a disease. So I know some people can live their life through their disability, and it is a very prevalent force in their life. But I think for me, anyway, in doing so, it would have held me back from my full potential and the possibilities of what I've gone on to do. So I've never actually thought of myself as having a disability, but rather there's a glitch in my system that occasionally sends things off the rails. And it was a huge impact in terms of my jobs and my work. So I had to put supports in place to compensate that. And we'll talk about that a little bit later. So this approach has not held me back about being very open and being very forthright about my diagnosis. Prior to my work as CEO of Open Doors, I was head of CSR and comms for a multinational. And I've had quite a varied career. I was campaign manager for Stephen Donnelly in 2011. That's Stephen Donnelly. And I was also the comms coordinator for the marriage referendum, and before that, head of comms for the Bar Council. So I've managed to hold, high-level jobs under a lot of pressure and worked it through. And I think that's one of the takeaways from this, is that people with mental health difficulties can do these jobs and can be a very vital part of the workforce. Despite the diagnosis or despite ill health, with the right supports in place. And they're different for everyone. What works for me mightn't work for someone else, and we'll talk about them too. The common thread in all my jobs is, one, that I was open going into them. If it came up, I was very forthright. But two, I had bosses who backed me fully and colleagues who supported me. And that meant I was operating in a very supportive environment. And this actually, for me, alleviated symptoms, because it meant I took far less time off work and could manage through when my mood or judgment was impaired, because I could sense check my work and grow confidence and trust in myself and my judgment. And, I'm sure at times it was quite a burden on my colleagues, and I'm aware of that. But I'm very lucky. It's one they bore with really good grace and helpfulness. And to be honest, it's made my achievements such as they are possible. So I've been very lucky in that. And I wouldn't like to work somewhere that didn't accept the whole of me. You give so much of your time and your life to work, and your energy and your thoughts and so on. So I wouldn't want to work in a place where you couldn't be your full self. And I certainly want to be part of its help or success if it was negative to someone with a mental health diagnosis. But again, I recognize this is not the case for everyone, and it can be very difficult. And one aspect that I found particularly hard to manage was my anxiety, which accompanies my illness. And it was definitely sparked by work and amplified by any type of stress or any type, for me, perceived threat or aggression. And it manifested itself in the fear of doing something wrong or making a mistake. And that's a really high burden to put on yourself. And it doesn't allow for human error or for managing your emotional reaction to other people and what you perceive their actions to be. And it also doesn't allow for what's going on in other people's lives and their stress or anger and annoyance that may be nothing to do with you, but it's a perception. So when I was stressed, particularly in the past, I would have to change my meds. I'd take a lot of Xanax. I'd try and go for a walk just to clear my head. And I would smoke a lot, and I would drink a lot at the weekends. And I'm not saying that is the way to go. I'm saying there were coping mechanisms at a certain place and time, and they weren't the best ones. So here I am in my present job, handling it a lot better, using exercise, talking therapy, and friends as a sounding board when there are difficulties to surmount. I also very much rely on my colleague Siobhan, who is both a work confidant and a friend, to discuss issues and find resolutions that are not going to be handled in a stressful or anxious way. And I'm very lucky in that support. And a weird thing, but I was just thinking about this today, I find aging has helped. There has to be some benefits, as it tends to give you a perspective, and it gives you more confidence in your judgment and in your actions. And in my case, it's given me a voice, because up to the age of 40, despite working in comms most of my life, I never did a public presentation because I was so nervous and so convinced I'd get it wrong and put up so many barriers in place. So, you know, brilliant. I'm older, but better, I hope. And it's different for everyone, and you have to find the supports that work for you. But I do think they are vital to ensuring a good workspace and mindset to working, and to bring happiness to your work, and a sense of achievement and so on. And they're very different for everyone. One of the key barriers for people with a mental illness in work is stigma. And I've worked with the Wear and Headline on reducing stigma and doing media training and mentoring and so on for people in similar circumstances. And for me, stigma hinders treatment. It can amplify the illness and can be a factor in harm. You know, just due to people not having resources or supports, or an inability to seek help due to the fear of disclosure and a lack of understanding. And its detrimental effect cannot be underestimated. And to bring it back to open doors, because I know I've veered way off, stigma follows those who I work with now. They're stigmatized for their background, their culture, their nationality, color of their skin, or perceived lack of ability. And I'm really proud that I lead an organization that everyone who works in it has lived experience in one area or another and uses that to help others. And I think that's a really key part of our organization. our focus is on creating education opportunities, training, internships and jobs, and getting employers to see past bias, be it conscious or unconscious, and hire on merit. And that's one thing we keep saying, it's on merit. You're there because you deserve to be there. You've earned the position, you have the skill set. And I think that's really important. And I think it's really important in amplifying someone's confidence in the job. It's not tokenism. So, and one of the things we thought about in the work we're doing recently is creating mentoring in order to increase confidence and help people move past stigma and bias about whatever condition they may have or where they're from or so on. And that's only started, but I think that's going to be really, really strong support for people. And again, working with companies who are the mentors and their employees to help see how the workplace can be beneficial to the person in building their confidence and their skill sets and so on, and removing the bias on both parts. So it works for both the mentor and the mentee. That said, stigma is better even in the last 20 years. I'm really lucky. I've never allowed it to impact on me. I've been very open and treated it as it is. It's a chemical imbalance. It's genetic. It's commonplace. Other people have it. You know, let's talk about it. And though I lost friends, they were never friends. And the jobs I didn't get due to being honest about my condition, they're not places I would have thrived anyway, because I have a very big mouth, as you can tell. So I wouldn't have been happy there. So all the better. And it also, sort of thinking about stigma, also led me to work with HIV Ireland, which is another stigmatized health issue. And I always thought I could bring learnings to it and find a community who I identified with for various reasons, but stigma being one of them. And this approach continues today with my work with the Open Doors Initiative. We support people with disabilities on pathways to work with employers who have an ethos of inclusivity and diversity. They don't recognize stigma or play to it. And they live this ethos in their hiring practices and in support and embedding employees into work. So just on that, I think diversity means hiring difference, and inclusion means recognizing intersectional identities, so the sum of the whole person and how they improve our work with the different perspectives they bring. And I think it's so much more beneficial to a workplace rather than just hiring someone who's the mirror of yourself or who you have so many commonalities with, because you get a sameness of thought. And this absolutely includes those with mental ill health and the issues that can present, because they have a different take on solving problems or amplifying ideas and so on. And I think they're a real resource and a real help to any workplace, again, on merit. So the other sense I would ask you to consider is look at belonging and realize that you recognize the value of the person as equal to all others who work for you and treat them as equal in all respects. And it's not tokenism, as I mentioned earlier. It's equality, and it's more than box ticking. And people, I think, outside of companies can see those who really have this ethos and don't just play lip service to it. And we work with all our companies to further instill these values in them. There are 1 billion people with disabilities in the world, according to the World Health Organization. And these can be apparent by the use of a wheelchair or a crutch or a prosthetic. And they also found that there's up to 10% of Americans alone who have some sort of invisible disability, including people with chronic health conditions. And for some, being invisible helps to hide them from their employer. But I would argue it leads to no reasonable accommodation or support or attempt to tackle bias or change a mindset. And I imagine this must make for a very unaccommodating environment in which to work, and results in fear and anxiety and a lack of confidence, as things can be misconstrued very easily. So in our work, while there is difficulties at the moment with COVID in creating the training and internship and jobs we want to do, and resources are hampered for both companies and ourselves, we're working through this to try and deal with them through mentoring programs, online training and seminars, and assistance in onboarding where possible. And I think all these services can instill confidence and preparation for interviews and work, and they are of course all aimed at marginalised communities. So there's commonalities and learnings that go through all our work from all these different groups, and they make each other stronger. I truly believe that companies who live our ethos will try and work through this situation and come out as stronger employers as a result. They made me CEO with full knowledge of my mental status. I don't know if you call it a status, but we'll go with status. And they could see past that to the abilities that I have to run open doors regardless. And again, the fact that everyone we work with has lived experience makes it a really great place to be your best self, and there's less stress and more confidence, and we're really lucky. Well, I think I'm really lucky by dint of that fact. And just to close off, I said earlier diversity means difference, and difference to my mind is a good and sacred thing, and homogenous thinking stifles creativity and problem solving. And I hope that people with mental health issues will form a far greater part of the workforce and on merit, and be them their best selves and bring all the difference that they have to the table. And just to leave you with this thought, your mind is both a powerful foe and a great ally. And I found personally that nothing is insurmountable once you can put your mind to it and push out the negativity and the lack of confidence and the worry and the anxiety and so on, and just focus on the object. There are supports, and while sometimes it can be hard to find them, they are so worth seeking because they can make such a difference. And this particularly applies to the workplace, where there's other people going through the same battles and looking for the same help and in the same position. And they and you can still be a key member of the workforce despite the illness you have. So I guess be kind to yourself and know that you're there because you're worth it. If you have any questions, I'd be happy to take them. And sorry, I didn't go into open doors in as much detail as I probably should have.
No, but thank you so much. And you know, I think I speak for a few people who've commented that was, you know, someone said you're a breath of fresh air, and that was, you know, it was truly inspiring. If is the word I think that I could use. You know, you raised so many points, and thank you for sharing your own story. And you know, I think you're an inspiration to many, you know, and to see, you know, the roles that you've had, and not just that you've had roles, but in your work that you're pushing for that change, and that you know, that more accepting, more diverse workplaces. So thank you for that. There are a few questions that have come in for you. So the first one is from Mary, who she's sharing her own personal experience as well, and that an employer transferred her to a rural location as they claimed it would be less likely that she was experiencing depression there. And are you aware of any of this type of practice?
No, I've never heard of it. I can't say I am. I think that decision should be driven certainly in collaboration with any person, because you're your best expert on what works for you and what supports you need. I'm not, I don't know the ins and outs of it. I certainly haven't experienced it, but that would strike me as rather strange.
Yeah. maybe we can see from other speakers. And then there is another question around, I suppose you were very open in your presentation around really making employers aware of, you know, mental health difficulties at the commencement of employment, and Mary's asking if that's something you recommend.
Again, it works for me. I've a big gob on me. I wouldn't be able to suppress it. It's very integral to my sense of self, in the sense that I want to get it out on the table so we can work through and deal with it together if it arises as an issue. And it has arisen as an issue over the years. I mean, the highs and lows are what they are and can be quite destructive. So I've always felt, for me, it's best to be upfront and straight about it, and then you can get supports put in place. And that has happened. I've been told, you know, take time if you need time, and just knowing you can, and knowing you have that comfort blanket alleviates a lot of pressure. And sort of, even if it's a case of I need to go for a walk before I do something that I find stressful in work, my last boss wouldn't have questioned it if I jumped up and said, I'm just going for a walk. There wouldn't be any questions about it, or sit at your desk, or any of that sort of thing. So I find it very beneficial. And, you know, some workplaces didn't like it, or would have been worried about it. But as I said, I wouldn't choose to work there, because I would find that a very stifling kind of atmosphere, and you constantly be explaining yourself and on the back foot and worried about getting ill, which, you know, will in itself ramp up the condition. So I find it very beneficial to be quite frank about it and quite open. Yeah.
Yeah, and there's actually Derek has given his personal experience as well, and thank you, Derek, for sharing. But he's lived experience for 25 years and working non-stop in the same place for the last 18 years. I do, however, struggle with memory and the fact that sometimes hallucinate the wrong numbers on a money amount or code. I just get, you're not the mathematical type, but what would you say to encourage? He gets from his employer, you're not the mathematical type, but he's looking for words of encouragement as he's thinking about training as an accountant, and he's halfway. Well done, you're halfway there, and it only worries him a small amount. So he's just looking for some words of encouragement from you and your experiences.
No problem. I have a desperate memory as well, so I can totally relate to that. I drive people bonkers because I forget the simplest of things. What I find to support, I'm really bad at maths as well, or accountancy, so I really admire the fact that you're taking on that course. Go for it. There are tricks, there are ways to work around it. For example, I always carry a notebook with me, or some way of capturing information, because I forget it. And, you know, a million thoughts are going around in your head. One pops up, you forget it. And I often find at night I start thinking about thoughts and processing thoughts. Again, I leave a notebook by my bed just to write them down to let me sleep, because I find the harder I am, the worse my memory is. So it's about managing your sleep, managing to capture the information. And also there are tricks to it. Actually, I read one somewhere recently that learning off the words for songs is really good for your memory. I don't know why I didn't go into the article, but I just thought that was really interesting. So you're constantly training your brain, and your brain is a muscle. So, you know, you want to keep training it to remember. And I think if you're naturally good at accountancy, don't worry about what other people tell you. You have to go with what you know you're good at and power through the course. Find ways, aids to your memory. I mean, I don't do accountancy for a very good reason, but I'm sure there's ways you can capture information and work through it without having to rely on your memory or having notes that you can refer back to. But don't let anyone tell you you can't do something if you think you can. Work it through, get the assistance, look up memory courses, for example. But I don't think it's the memory that necessarily is the huge issue, because I'm always told I have a good memory, and I just find that desperate, shocking lie. But there are tricks. Go look them up, Google them, do whatever it takes, but stick with the course, please do.
Yeah, and Derek, it seems it's making you happy, and I think that if it's something you're enjoying, you know, you're halfway there, that's an accomplishment in itself. It means, you know, it's not hindering you to a point where you're getting stuck. So if you're halfway there, you keep at it, I think. And Jeanne, a question for me, maybe in terms of, I loved the fact that you spoke about, you know, the fact that employers have to look at diversity of, you know, the real strength of bringing in different types of thinkers and different types of, you know, personalities, or, you know, people who do things differently. And I think internationally there seems to be a lot of focus on that. I've read articles in the Harvard Business Review and, you know, these other things that pop up on Twitter from time to time. But how do you feel in Ireland? Like, you know, we're a small country. Is that kind of mentality of, you know, of kind of the importance of diversification, is it coming stronger in Ireland, or do we still have some way to go?
A bit of both. I'm just thinking of one firm we work with. They're a small accountancy firm, and they joined us, and they started off with someone with a migrant background. Realized, actually, to Derek, she was very good at figures. She started off as an office admin. They realized she was good at his accountancy. So now they're putting her through accountancy course at night with the promise of a job at the end. And they had such a good experience from that. And it's a very small firm, 20 people. They then went and, again on merit, hired someone who was a wheelchair user, and brought them in, and I can't remember what job they were doing. I think it was data, but they found the experience incredibly beneficial. And they have a real ethos of diversity, and that so many of the companies we deal with do. You get some companies who are just, how would you say it? They look at people as sort of points on the scale, labor, staff, you know, they're there they're a means to an end. And they don't embrace the fact that the more diverse that cohort are, the more benefits there are for the company. And there's a zillion studies showing how diversity impacts on a company. There's a McKinsey study, for example, that shows over 1,000 firms, the ones with diversity had a 33% increase in productivity. So it impacts on the bottom line. You know, business is business. It is a business decision, but there's some who embrace it far more and really get the fact that not only is it a business decision, it means for better employees. And some of the feedbacks we've had from their companies, employees are so much more engaged, and they're really proud of their company, and they really enjoy the effect of working with different people who they wouldn't maybe met in their life before, or they wouldn't have relationships with, and that diversity brings benefits to them as well. So I think it's improving. I think it's very much improving. You could see it in the Pride March. You know, all the corporates want to be part of it. The question is, are they still there the rest of the year? And, you know, is it a real ethos? Is it a real value? And I think certainly the companies we work with, it is.
Okay, no, that's brilliant, Jeanne. There's just I think Mary Mick has just raised a question. I think maybe we can look at bilaterally in terms of, you know, her own case and, you know, being moved to rural Ireland, and the kind of, you know, I think you said you haven't been aware of that, so I don't know if we can discuss that anymore. But maybe if you send us an email, I'm sure we can look into it further. But yeah, thank you so much. And you know, I love your positivity and you know, the kind of that putting this in a very much that kind of diversity value added space, because you know that's so important, that you know everyone is different, and employers need to cater for lots of different types of workers and lots of different types of individuals, and it's beneficial to them. And great to hear about the work that you're doing as well. So I'm going to introduce the next speakers now. We're going to Cork, which you'll hear in the accents, and we are going to I'm going to ask Eric Frost and Marie McCarthy, who are job coaches with EmployAbility and who work on the IPS as job coaches, and Dominic, who is a service user and has used the IPS service. So the floor is all yours, or the virtual floor, I should say.
Thanks, Fiona.
Hi, how's it going?
Right, just trying to share my screen here. Bear with me 1 second.
So I think, will we let you just do the presentation first, Eric, and we'll pop in then afterwards?
Yeah.
Perfect.
So thanks a million, Fiona, and thanks for the opportunity for us to present here today. For all of those listening, good afternoon. My name is Eric. I'm the employment specialist with the Early Intervention in Psychosis, which is a pilot project based in Blackrock and Cork. And it's a project that's committed to the early detection, intervention and recovery for individuals that have experienced a first episode of psychosis. Later on, like Fiona said, you'll hear from my colleague Marie McCarthy, who will actually facilitate a discussion with one of her clients, Dominic, and he will give you a sense of his own first-hand experience of what it's like to receive the support of IPS. So, apologies. So, in terms of what we want to achieve today, we're going to look at what IPS is. So what are the kind of fundamentals that guide the IPS approach? We'll look at what IPS actually looks like in practice. So, you know, what's the day-to-day experience of an employment specialist who provides the service, and what does that look like for a service user? We'll then look at the benefits of IPS, and again, we'll look at that from the perspective of the service user, and also discuss, you know, what are the unique aspects about IPS? What makes it different? What makes it so effective? Like I said, we'll have a chat with Marie and Dominic, where Dominic will give his first-hand experience of what it was like to work both with Marie as his employment specialist, and also what it was like to receive the support of IPS. Finally, we'll discuss some outcomes that we've had. So, you know, myself and Marie are in position about a year. Realistically, IPS has been functioning as it was intended for about 8 months. So we've some kind of outcomes after about 8 months, and we'll give you some of the kind of numbers and things that we've managed to achieve. And finally, we'll conclude with just some concluding thoughts. So, IPS, I'm conscious that, you know, some people have heard about it, some people haven't. IPS stands for Individual Placement and Support. It's an intensive employment support program for individuals with mental health difficulties. And the program is guided by 8 key principles. So if you've never heard of IPS before and you're wondering what it is, these 8 key principles are really a guide in terms of what it looks like on a very real level. So first of all, we talk about zero exclusion policy. So what we mean by this is that the only criteria for someone to engage with IPS is that the client has expressed an interest in sourcing employment. There's no job readiness criteria. There's no traffic lighting system in terms of yellow, amber, green, nothing like that. What we're talking about here is someone who's got a real keen interest in employment. And this comes to one of the fundamental aspects of IPS, which is the idea of placing someone and then training. So we have a fundamental belief as employment specialists in the capacities of the clients we work with, And the idea is to support them into an employment opportunity, to give them access to the IPS program, and then provide them with the support when they're in the job. The whole program is based on client preferences. So from the initial referral to the initial needs assessment and career profiling, through to what kind of employers an individual would like to work with, what kind of environment, what kind of work hours, all of that is guided by the client. Now, it's a collaborative approach. The employment specialist is working hand in hand with the client to help brainstorm and come up with different ideas and different approaches. But it is fundamentally driven by the client. It's what they want. It moves at the pace that they feel comfortable moving at. And it's really about finding the right match for that particular client. So they have a huge amount of autonomy in terms of how they experience IPS. Employment specialists are integrated with the mental health teams. So this is quite new, and it's something we found when we joined in with our teams, that having a dedicated employment person on the team was quite a new departure, and it was a really exciting departure for members of the team. I think traditionally this might have fallen to maybe the occupational therapist, who has, you know, 1,000,001 other things that they're worried about and really don't have the time to be going out and building those relationships with employers. So we're fully functioning members of the multidisciplinary team. We attend weekly meetings where we discuss different clients, potential referrals. We're involved in the clinical discussion in terms of how they can be supported broadly by the team. And that's one of the big kind of key aspects of IPS, is that fact that we are there with the multidisciplinary team, and we have a huge input in terms of I suppose, advertising IPS and the efficacy of it. And then, you know, lots of conversations with key workers and different members of the team to try and increase the number of people who are being referred to the service. One of the key elements of IPS is the idea of a rapid job search. So every employment specialist knows that from the moment they begin working with a client, we have kind of like a 4-week window, and the goal at the end of that 4 weeks is that we've engaged face-to-face with an employer, discussing a very real job opportunity for the client who we've begun working with. And again, that's quite new, it's quite proactive, and it creates a sense of urgency, which from my experience has been quite beneficial for the clients we work with. There's a real tangible focus, there's a real sort of belief again in the inherent capacities that people have. And part of the role of the job coach is to encourage individuals to actually see their skills, their experiences, and the capacity that they have, that the employment specialist fundamentally believes in. Employer engagement is another key aspect of IPS. So the employment specialist spends upwards of 60% of their time out in the community. So this isn't sitting in an office somewhere with any of the teams. This is out meeting clients in coffee shops. It's out engaging with employers, whether it's cold calling employers, whether it's setting up meetings with employers. We spend a huge amount of our time linking in with local and regional employers. And what we're trying to do is, first of all, we're trying to generate an awareness for the fact that this service exists. And then what we're trying to do is create job opportunities for clients that we might have at that point in time, or clients that we expect to have in the future. And there's a big role there in terms of trying to get the buy-in from employers to support the work we're doing, and on a very, very simple level to try and tackle the stigma that still surrounds trying to support individuals to source employment. There's a focus on competitive employment. I think this is a really powerful message to the clients we work with. When we're sourcing job opportunities, we're not talking about a set aside role within an organization. We're talking about real live job vacancies available on the live job market. And so our clients are up against Joe Public when they're going for any particular position. And I think that's a real powerful message to the client, because again, what we're saying is we fundamentally believe in your skills, your capabilities, and what you bring to the table for any employer. And that's backed up by the fact that, you know, these are all live job vacancies. It's competitive employment. It's about you getting back to work like anyone else in the workforce, and having the support around you to be successful. The final thing we do is we provide some benefits counselling, and I suppose that's within the context of a broader career plan that we put together for all the clients we work with. And this is things like, you know, if someone's going back to work and they only want to work part-time, they might wonder, well, what impact does that have on my medical card, or what impact does that have on one can work, and then how much they might receive from their disability benefit if that's what they happen to be on. So we support all our clients with these kind of conversations to make sure that when they do go into an employment opportunity, they're fully informed and they're fully prepared for how that's going to affect their current lifestyle and what they're used to. So hopefully that gives you an insight in terms of the kind of key principles that guide the IPS approach. So what does that actually look like in practice though? So you kind of have the theoretical aspect of what IPS is all about, but what does it look like day to day? This is what we'd like to think of as the standard journey for someone who engages with IPS. So after the referral has come through, the client will engage in a vocational assessment with the employment specialist. So this is a document that I suppose stimulates conversation, and we talk about things like, what are your experiences? What are your values? What are you passionate about? What are your hobbies and interests? What did you like about previous employment opportunities? What didn't you like about your previous employment? And what we try to do is we really try and find out, like, who are you as an individual? What makes you tick? What are you passionate about? What gets you excited? A very fundamental question is, you know, if you could be doing, what would you like to be doing in the morning? If you were getting out of bed, you know, the alarm clock's going off at 6:30, what would you like to be doing? What would get you excited? And these sometimes are questions that we're probably all guilty of not considering enough. And certainly I find with the clients that I work with, these are refreshing questions to be asking. And then also what we're saying is that we'll support you to try and achieve those goals, whatever they happen to be. So this vocational assessment is a real holistic view of the individual, all their experiences, putting it all together. And then hopefully what we get from that is a couple, 2 or 3 job preferences that the individual's really happy and really comfortable with trying to go out now and source. In terms of CV development, you know, we help with targeting CVs towards different industries. If someone wants to work in retail, then their CV naturally should be very different to someone who wants to work in a manufacturing environment. And so we provide the real practical support in terms of trying to update CVs and making sure that they're targeted towards particular industries. I've touched on the employer engagement side of things. Like I said, we're building relationships all the time with employers. And so, you know, the hope, and it's proven to be the case on occasion, is that when we begin working with a client, we might already have an employer that we think might be a really good fit for an individual. And of course, it's all based on the individual's preferences, but we build those really strong relationships with employers. And that's the employment specialist going out and meeting with companies and trying to carve job opportunities. And then also there's an onus on the client themselves to go out and start job searching and start creating opportunities for themselves. Like I said, it's a real collaborative process, and that's the way we want it to be. We help again with very practical things like online job applications and assessments, filling out questionnaires, application forms for different types of job vacancies. Also what we do is we provide interview skills development, and this is all on the basis of need. So some clients want that real hands-on support in terms of preparing for interviews and going through questions. And other clients, you know, they're comfortable and they're happy and they're content in terms of how they'd approach that situation. So, you know, the support is only provided if that's what they want. I suppose the last thing we would do then is provide the on-the-job support. So this is linking in with the client on a consistent basis to make sure they're happy and they're comfortable in their role. It's constant communication with the employer to make sure that the individual is settling in well with the team, that they're enjoying the environment, and also to try and see if there's any way at all that we can help make sure that it's a really successful match. And if there are any issues, there might be issues around attending appointments, you know, staggered breaks, whatever it happens to be, we provide all of that support to a client. And so I think it's really comforting for a client to know that the journey doesn't end just because you get into a job. You could argue actually that a lot of the real work actually starts once you get into the job, because again, coming back to this idea of placing someone and then training them, the real massive support happens when someone gets into a job, and we really want to try and make sure it's a successful match. So that gives you a little bit of a sense of, I suppose, what IPS looks like in practice. Again, it's a fluid process. So sometimes someone goes into a job quite early and finds out it's not for them, and they revert back to, let's go back to the vocational assessment. Let's see what we need to change. Let's see how our preferences might have changed based on your last employment experience. So it's a very fluid process, and you can jump between stages, but that gives you a sense of what the kind of standard progression might look like for someone. So let's talk about the benefits of IPS, and I suppose more specifically, what makes IPS unique. Now you'll probably see that there's a common trend between the 8 guiding principles for IPS and then actually what the benefits look like. So we talk about accessibility. So like I said, for anyone who's engaged with the mental health teams, all they have to do is express an interest in employment. And this sometimes might come organically from the individual, or it might be encouraged by a key worker or someone else on the multidisciplinary team. But at that point, a referral should be filled out and the individuals should be having a discussion with me about IPS within a couple of days. So it's hugely accessible for those clients who want to avail of the service. Like I said, there's no job readiness criteria, and this has been a huge sort of message that we carry when we're in discussions with anyone about IPS, and also when we're going back and having discussions with the multidisciplinary team. We're really passionate about not deciding whether individuals are ready to go to work or not. If an individual is really motivated and wants to source employment, then it's our job to provide them with the support and the opportunity to engage in IPS to see if we can make that become a reality. It also leads to quicker referrals. So like I said, the referral process is really quick and easy. Any member of the team can get onto myself straight away and a referral can happen within a matter of hours. And within, like I said, a couple of days, you're already having a conversation with the client about IPS. IPS is 100% client-led. From the initial referral through to the vocational profile, identifying job opportunities, identifying employers, what kind of environment you want to work in, it's all driven by the client. Like I said, it's a collaborative process and there's lots of discussions that go on and brainstorming, but the client has complete control over what their experience of IPS is like, down to what support looks like. So for some clients, they want us engaging with employers on a regular basis on their behalf. For other clients, they're happy to do that piece themselves and they want to take control of that. And so it's a real empowering approach to supporting people into employment. The client really does have the reins here, and it's up to us to kind of honour their wishes. A huge benefit to IPS is the collaboration between services. So I've discussed already, myself and Marie would be fully fledged members of the multidisciplinary teams, and that allows us to have the informal discussions that happen in the office between key workers and BFT workers, psychology, where we're constantly pushing the message of IPS and trying to generate as much awareness as possible. And often out of those informal conversations, you'll have referrals that emerge. The other thing is we lean on the collective wisdom of the team. So I have lots of discussions with key workers, occupational therapists about, look, this is what I'm thinking. These are the kind of conversations I've had with my client. What's your input here? What do you think would be a good approach for this individual? And again, so it's a real collaborative process between myself, between the client, and between the team as a whole. The other side of this is the fact that obviously I'm a job coach with EmployAbility. So I also have the expertise of a team of job coaches who have experience in terms of building relationships with employers, who have experience in terms of placing individuals who have lots of different challenges, be that physical or mental health challenges. So it's the kind of marriage between those two services that really makes IPS unique and allows us to really kind of be successful in terms of supporting individuals to source employment opportunities, and then it's all about supporting their recovery as well. I've spoken about the fact that the IPS is time unlimited, and this is an amazing offering to clients. So there's not too many programs where you could say the support will be there for you as long as you want it. It's a remarkable thing to offer someone. I know with EmployAbility that the job coach normally offers support for about 18 months. In some situations that might be extended, but generally from the time you start working with EmployAbility, there's a clock counting down. That's not the case for an individual who's utilizing the support of IPS. Yeah, it's just an incredible offering, and what it means is it allows people to try things. So the normal conversations I'm having with clients are, I don't know what to do. I don't know what job opportunity I want to move into. I don't know what would work for me. And what I encourage people to do is to try things. Try what it's like to work in a retail environment, or try what it's like to work in a manufacturing environment, or whatever it happens to be. And with that time unlimited support, what it means is that if the first opportunity proves not to be the right one for you, then we can come back to the drawing board. The support is still there. We take the learnings from that experience and we move on, and we're more informed now when we're looking for our next opportunity. So I think the time unlimited thing is fantastic support for people. And what I found is clients dip in and out of the service when they feel like they need it, which is great. We've spoken about how fast paced it is. Like I said, within 4 weeks, the goal of every employment specialist is to be having that face-to-face conversation with an employer about a very real job opportunity. And I think what that does is it gives the client a real sort of focus and a real emphasis in terms of, you know, let's try and make something happen here. It's really tangible. You can see the progress, you know, as you move through the initial assessment, through to preparing for job interviews and approaching employers. You can really feel and touch the progress that's happening. I think that's really powerful for the clients who engage in IPS. The final sort of standout benefit, certainly from my own experience, is the idea of employer engagement. So just on a very practical level, for those clients who want this kind of support, having someone to go and advocate on behalf of you and talk about all the skills and qualities and characteristics that make you such a strong potential employee, it makes a huge difference. Going out there, talking to employers, building those relationships and trying to create that supportive environment that will support the individual's recovery as a whole makes a massive difference, I think, to clients. And I think they see it as a huge benefit of engaging in IPS. So hopefully you've got a sense of what IPS is, what it looks like, and what are some of the key benefits for the individuals who engage in IPS. Before I hand over to my colleague Marie and Dominic, I just wanted to give you a sense of one of my own clients who kindly shared a testimonial of their experience working with IPS. So what she said is this: with the IPS, I managed to get a new temporary opportunity through which I managed to build my self-esteem, build trust in myself by watching myself doing brilliantly in a completely new capacity I never worked in before. I also built trust in others and earned the communication skills. This opportunity helped me to grow and develop. With that, I'll hand over to Marie, who's going to facilitate a discussion with Dominic about his experience with IPS.
Hi Eric, thanks very much for that. Hi Dominic, how are you?
I'm very well, Marie, and how are you?
I'm very good, thanks. First of all, I want to say thanks so much for coming on today and joining us for this conversation and discussing your experience of the IPS process. No problem. Okay, great. So will I just get started? Dive straight in?
Yeah.
Perfect. So can you just tell me, what does employment mean for you?
I suppose your kind of idea of what it is evolves over time, but you know, I suppose you spend a lot of time, if you're working full time, you could be doing it 40 hours a week. I suppose a lot of it is linked to your kind of sense of maybe identity in certain respects, your sense of self-worth. You know, I suppose if you maybe you could be working from the age of 18, maybe early 20s up until your 60s. So it's a large chunk of your life and you spend a lot of time doing it. So it is going to be linked a lot to your kind of, I suppose, your sense of identity, your sense of self-worth. You would like it to be a vocation, not just strictly a kind of a means to an end, and that it's just a salary and a salary alone. I suppose you just like to kind of see yourself being happy in the role, that kind of thing, I suppose, really, you know, that it's not just going in for a while, clocking out, that it's something that you kind of like doing, that it's something that's a part of yourself, you know, something like that, I suppose.
Yeah, and I think what you said there is something that like can resonate with all of us. I think, you know, that function of employment that you're talking about, you know, that it's meaningful, you know. I think that's something that can resonate to all of us, because I know employment means different things to different people. We all want it to be meaningful, really, don't we?
I know for sure. I mean, I suppose, you know, I've had a couple of jobs in the past where, yeah, I wouldn't have enjoyed them too much, and it does impact in a negative way upon your kind of sense of self-worth, your mental health and so on. Whereas if you're in a job that you kind of feel that you're getting up in the morning and you're maybe kind of enjoying it, you're in a nice environment, you're enjoying what you're doing, yeah, it makes all the difference, really.
Yeah, exactly. Yeah. And just to move on, I suppose, to talk about like the IPS supported employment program. Would you ever have been involved in supported employment programs before, or is this your first time accessing a service like that?
No, first time. I was never involved with anything like it before. So yeah, it was my first time. Yeah.
Okay. And how did you find, I suppose, referring into the service and accessing it? Like, what was that process like?
No, it was pretty straightforward, really. You know, I suppose I would have been, I suppose, accessing mental health services in Tusney and Ballincollig in Cork, and through that the RISE program. So it was part of the RISE program. That's how it was kind of how I came upon it, and yeah, through that I suppose met you and started engaging with you and kind of looking at different opportunities. So no, it was very easy to access and I suppose user friendly, if you like. So first time availing of a service like this, and yeah, I found it very, very helpful and easy to access for sure. Yeah.
Okay, brilliant. And just about the service itself, what, I suppose, and your experience of it, what did you find that was beneficial to you and also may not have been beneficial,
I suppose, obviously about a year ago, I would have been unwell and would have been hospitalized and all that kind of stuff. And it's a traumatic event in one's life when that happens. And, you're not really, maybe you're in a bit of a muddle, you're not thinking clearly. It's an existential sort of a crisis, really. So just trying to kind of, and then, as I said earlier, work is a big part of a person's kind of sense of self-worth, identity, and just trying to kind of get an idea, okay, what is it that I actually want to do? Because I mean, the jobs that I did have previously, looking back on it, they made me unhappy and contributed to me becoming unwell. So just having to kind of recalibrate, really, and yeah, just kind of challenging things in a kind of and having those conversations about what it is that I actually wanted to do and reconnecting with that, and challenging things. As I said, I mean, it kind of doesn't become crystal clear straight away, but from talking to you over the course of a few weeks, you start to kind of get an idea as to, look, okay, what direction I need to go in, the mistakes maybe that I was making in terms of jobs that I was in and stuff like that. And just, I suppose, having those conversations as well, your confidence builds, because when you're through something like what I was through, your confidence takes a big hit. And the thought of going back to work, going back into the workplace when you're very anxious and so on, can seem very daunting. So just, I suppose, talking with you, meeting with you even on a week-to-week basis, you feel like you're moving in the right direction incrementally. So that was one of the kind of the main things, really, just kind of building that confidence and kind of getting a clearer idea as to the direction I needed to go on and what I needed to do, I think.
Yeah. So really, just kind of, I suppose what you're saying is that space to explore your options was vital for you, really, was it?
Definitely, yeah. Something that I found very helpful, just kind of that space, as you said, that non-judgmental space to kind of explore your options and build your confidence up again. That's, absolutely found that very helpful and beneficial.
Okay. And is there anything, I suppose, that you'd like to see about the program, any kind of services you'd like to change or any improvements? Because I suppose for us, really, what's important is feedback and knowing what we can do differently to reach a better standard,
Of course, yeah. I mean, being honest about it, I've been very happy with the service. There isn't really anything that I could say. I mean, looking back to, I suppose, when I first started engaging with the service last September to where I am now, I mean, back then, going back into employment seemed a kind of a distant prospect, but I'm back in employment, happy with where I'm working. So, I mean, there isn't really anything that I could say that would be a negative or a kind of a black mark or anything like that. I don't know. I mean, look, I'm speaking in a personal capacity, of course. But no, I mean, I've been very, very happy with the service and I found it very, very helpful. And, I wouldn't be where I am without it, to be honest.
Yeah, and as you said, this is your experience. Other people are going to have different experience of the IPS program and different thoughts about it. So, I do appreciate you coming on and saying all that. Is there anything else that you'd like to add about the program or your experience of it?
No, not as such, really. I suppose one of the things that I did kind of find helpful was even meeting you in a setting that wasn't a clinical setting, just meeting you out for a coffee and things like that. Kind of, yeah, I even found that kind of helpful, because if you're in a clinical setting, sometimes you might feel like a patient or something like that. So I just found kind of meeting you out, having a coffee, that was more relaxed. Again, just speaking from a personal capacity, and kind of when you're more relaxed, maybe you're kind of more inclined to kind of, I suppose, find things easier to talk about or happen upon things that are kind of more insightful. And yeah, that's something, just the kind of engaging with people, having a coffee and all of that. I just found that very helpful from a personal perspective.
Yeah, and God knows we love our coffee.
Well, the coffee isn't great, Marie.
We can't be saying things like that. Okay, so Dominic, thank you so much for coming on. I appreciate it. I am going to actually hand you back to Eric now, who is going to conclude with a few statistics. All right?
No problem.
Okay, thank you.
Thanks, Marie. And listen, Dominic, we've not met before except for kind of just this morning. Thanks so much for sharing your own experience. I think it really resonates with people when you hear someone who's actually had the direct experience of the service. So we can talk about it all day long, but you've actually lived the experience of it. So thanks so much.
You're more than welcome. No problem at all, Eric.
So, like Marie said, I'm just going to talk a little bit about some of the outcomes that we've managed to achieve. Like I said, we're about eight months in to IPS really kind of coming together in the way that we had envisaged it. So, I suppose since we've started, between myself and Marie, we've had 39 referrals to IPS. We've had, in terms of the clients that have engaged in IPS, the number is 23. And I suppose the reason why there's I suppose the difference in the two numbers there is because there's a lot of conversations that happen with clients who might be referred to us, who for one reason or another decide that it's not the right time for them to engage in IPS. And again, that's entirely their decision. Or else they've decided to go a different route, whether that's to chase educational opportunities, or there might be some other extenuating circumstances, people have moved away perhaps. So out of the 23 people that have engaged in IPS, there's been 22 job opportunities created to date. In terms of the total number of clients that have actually secured employment, 14 different clients have secured employment. So some of these clients will have secured more than one role during their time, and that's why you have the difference between the 22 job opportunities and the 14 as the number of clients. In terms of engagement to successful employment, we're at about 61% at the moment. So for those who engage in IPS and are kind of really motivated to source employment, 61% of them so far have managed to secure a supportive employment placement. So look, it's early doors. Like I said, we're only 8 months in, but it's been a really strong start, I think, for us. And you know, the one thing I'd say about any outcomes that you have in any of these programs, it's all down to the clients and their willingness to really source an employment opportunity and their willingness to engage with IPS. And then, you know, we can support as much as we possibly can, but clients, you know, they really take ownership of their experience of IPS. Finally, just to add some sort of conclusion remarks, there's a significant and growing body of evidence supporting the efficacy of IPS. The last slide actually on the presentation has a few links to some of that research. One piece of research suggested on average that participants secure employment through IPS 61% of the time versus your standard local vocational services 23% of the time. And this was a paper published by the Centre for Mental Health in 2009. I suppose just to conclude, it's our fundamental belief as employment specialists that IPS should be viewed as a fundamental aspect of mental health service provision. We think it needs to become as valued in intervention as behavioural family therapy, as psychology, as peer support. We think it plays a transformational role in terms of people's ability to manage their own mental health and their experience of day-to-day life. And we, you know, would be huge advocates of IPS and the difference it's making in people's lives currently. And, you know, we just really, really want to see this rolled out, you know, to every mental health team in the country. With that, we thought we'd end on sort of an inspirational quote or something that we feel like reflects, I suppose, our values and our view of IPS. So we borrowed a quote here from Confucius. What he says is, "Those who think they can and those who think they can't are both usually right. The role of IPS is to support people to think they can." And with that, I will hand back to Fiona. Thanks very much.
Eric, thank you so much for that. I think, you know, it's clear what's come through in the comments that, you know, both you and Marie, your passion for what you're doing yourself, and we've spoken a lot, and, you know, Dominic, you referred to it as well, and finding something that works with you, for you, and Jeanne said it as well, that, you know, that's really important. And, you know, thank you for talking us through it. And Dominic, thank you in particular for sharing, you know, your own experience. And I think, Marie, you could be, you know, the next Pat Kenny with your questioning. It was really well done. So thank you both. Just so that we have time for questions and answers, which we will. If anyone has a question for Dominic, Eric, or Marie, please just put it in the chat or the questions box. But we're going to go from Cork now to a fellow Donegal inhabitant originally, but he considers himself, I think, a Dublin man now. So John McCusker, he is the operations manager for the National Mental Health Office. So John, you're going to jump on now and build on, I suppose, Eric, Dominic and Marie's work.
Hello everyone. How are you? Are you able to see me there? Listen, thank you so much. What's impressed me about the presentations this morning is that through the two different presentations, we're coming at the same type of work in the same way, in that I come from the mental health office, and Open Doors and the early intervention programs are doing the exact same thing. We started our work in September of 2018. And what's impressed me about what Dominic has said is that of the 27 teams that we have in place, out of a total of 213 community mental health teams nationally, we have 27 people working in teams in the same way as Eric is doing for the early intervention programs. But what's impressive about it is that it's a collaborative process. It's about hearing the voice of what everybody does, but it's also about giving people choice. So our success is based on, we've got 1,143 referrals to our service as of March of this year. COVID-19 unfortunately has had a bit of a knockback on us, but to say, you know, of 27 teams, you know, throughout nationally, we have had 1,143 referrals is impressive. Of those 1,143, we have assisted 200 people into employment. And in fairness, some, because of the nature of illness and people's engagement, they come and go. But as of March of this year, we had 125 people who were in full-time employment. That means they held down a full-time job. And as of now, during COVID, unfortunately, there was a decrease in that. And that number went from 125 down to 86. But we still have 86 people who are in full-time employment across all walks of life, whether it be IT consultant, insurance brokers, centres, whatever you name, we have them in place. And we have got the feedback, and we have got the kind of acknowledgement to say that it's working. So what have we done? And again, we have done the same approach as Eric and Marie have done in implementing this change, and that it's really important that we hear the voice of our service user. So they lead the way for us. They dictate the pace. They tell us what they want, and our job is to go out and do it. The second thing that we do is we support, in that it's our job to link with the employer. It's our job to make sure that it's competitive and that the employment is got on merit. So how do we do that? And again, that's done with consultation, with discussion, acknowledging that we have to give dignity to the voice of our service user and that they tell us what they want. So it's our job then to go out and assist, and that's the word, assist. That's all we do. So from that perspective, we can now tell you that we want this to be sustainable. And what's important about sustainability is that we need money, unfortunately. We need money that we can employ job specialists, job coaches. And currently we have 27 employability specialists or job coaches working in our 27 mental health community teams. So we now need to build on that sustainability, and we need kind of bridges and introductions to other organizations in order to make it effective. So one of the things that's been really effective for us is that luckily we have won an excellence award in the HSE, the Excellence Awards. So we won the Mental Health Champion category, which is a great platform for us to launch the next stage of sustainability for the IPS. So what that's done is that's enabled us to promote the IPS project through the IPS component of the Excellent Award. So it's given us a platform, first of all, to engage with the corporate world. For example, we are now working with the IDA, and we have a meeting actually on Monday where we're trying to set up a networked program whereby we kind of meet with corporate employers from the likes of Intel to Tesco's to Lidl's to the big computer companies to educate and inform of what IPS can do. And we're doing that through the collaborative process through our employability specialists. We also work with the National Learning Network, and we're also going to get the service user in to come and tell their story and basically tell people how effective this service is and the benefits that it has to organizations. The second thing that we're going to do is we have, through the Excellent Award, is that we have now made contact with our national HR department in the HSE. And we're basically trying to promote to them the benefits of IPS. And we're doing it through the competitive employment stream. So we're saying that everybody should be going through the employment competitive process, doing the application form, coming in and doing the interview. But the IPS is an ideal model for the handicap component or cohort of what the HSE offers to our employers. Because we have to, by law, we have to fill 5%, I think it's now 7% of people with disabilities in our local jobs. So we're actively working with them now to make sure we have a supported approach to getting people in place. The last thing that we're doing is that we're now actively working to make this process sustainable going forward. So we've done that in two ways. First of all, Fiona referenced there that, the new Vision for Change document, the reboot. So what we're doing is we have made a submission and a business plan that from June of 2021, when the funding for the initial phase runs out, that the HSE will take up the cost and continue to employ the current 27 job coaches, along with an additional 3 job coaches, so that we can make this sustainable and spread the word and spread the ethos of IPS into other community mental health teams. The second thing we're doing is that we have gone through our commissioning body in the HSE Mental Health National Office to make sure that we do get funding. Unfortunately, because of COVID and how funding may be allocated this year, we're not sure if we will get it, but we're making a fairly strong case. And this is why days like today are so important, because we need the input from Open Door, we need the input from Mental Health Reform and from other organizations, that we can have a kind of collaborative approach and form a lobby type group so that we can, press the need for the culture changes to what we're doing. So I didn't use the presentation because Eric covered it really well in his presentation. So I'm sorry for making poor Amy flick through all those slides.
Thank you so much, John. That was really, it's really great to hear, I'll put my camera on. It's really great to hear the success, and the IPS project is something Mental Health Reform has been advocating and will continue to advocate for investment in, because we think it's highly important, and especially given the current climate, more more so than ever. It's important, and just so people are aware, that so the Department of Employment Affairs and Social Protection, they take submissions for pre-budget proposals, and one of the we're finalising our submission at the moment, but we do reference very heavily, IPS programme in that submission, to ensure that it is funded, even though at the moment it's not in their budget lines, but we don't really mind where the money comes from as long as it's there, I think, in the end. And the other things, I suppose, just to raise that is in that submission is around disability payments, to revise them and to take into account those with severe and enduring mental health difficulties and the episodic nature of those who may need access to those payments, and the loss of benefits for people undergoing partial capacity benefit. So just really that we ensure that risk is really minimized. But yeah, thank you, John, for that. So there's a few questions for all of you, I think, who are coming in. So there's one here for Dominic, Marie, or Eric, so you can decide maybe who would like to take it. But someone is asking, what would you say is meaning from work or job satisfaction? And for this person, it's being part of a big project, taking part in big capital purchase, or the company I work with winning a competitive sports competition. And can you name two things that, what is that kind of job satisfaction piece for you, and maybe for all of us? So do one of you want to jump in there?
I can answer that, I don't mind. I suppose it's about kind of ultimately getting satisfaction out of work and not feeling that going in, just making up the numbers every day and just kind of strictly being there, just clocking at 9, leaving at 5 and just collecting a check and leaving. I mean, okay, ultimately you need to earn a salary to pay your bills and so on. You don't want to be doing that for 40 years. You want to feel that you're kind of actually getting some action, you're getting some enjoyment, you feel that you're contributing to some kind of greater good. And I mean, I've had jobs in the past where you're just a cog in the wheel, you're a kind of a statistic almost. It doesn't really matter if you're there or not. So I mean, feeling that you're valued, getting, as I said, just satisfaction and kind of enjoyment from your work, feeling fulfilled. It's very important. There's nothing kind of worse, from my own personal experience, any other than going in every day into an environment that you don't find enjoyable, that you just, that's not what life is supposed to be about. It's about more than that. So yeah, just feeling that you get enjoyment out of it and that you're doing something worthwhile and that you're contributing to some form of greater good, I think ultimately forms the backbone of a lot of job satisfaction from a personal experience anyway.
Yeah, thanks for that, Dominic. I think that's relevant for everyone, that we all should be, no one should be unhappy going into their workplace. And there is the whole kind of body of work around decent work, and that everyone has a right not just to work, but that they have a decent work where they feel like they're contributing to something. So thank you for that. There's another question that came in, that is, someone is saying, would you agree, John, or Jeanne is gone, I'm afraid. So John, this is probably for you, that the mentally ill sector, through challenge with some jobs, such as highly academic jobs or retail, that they tend to do better at other jobs, such as peer work, charity work, the arts, and the handicrafts. So John, do you agree with that statement, or would you have other thoughts?
Well, I would have a different view in that I think there's a job out there for everybody. Yeah. And I think, again, we may need a bit of support, but we all have unique talents. And I've discovered that, you can be a solicitor who needs to go back to work with a bit of support, or you need to be, you can stack shelves in Tesco, but it doesn't matter as long as you feel valued. So, and there is a job out there for everybody. What struck me about the IPS was that, you know, people told me, whether it be they be an academic, a solicitor, or a labourer, they said what the IPS did was it made them feel important again, because in some cases they thought their work life was over, and what happened was that the IPS gave them a second chance. So it doesn't matter what your career opportunities are, as long as you're supported and have dignity. I think we all need to, you know, step up to the plate and just go for it, you know, and don't let anybody tell you you're not good enough. You are. Just have confidence, and that's what the IPS job specialists do. They encourage, give you confidence.
Brilliant. Eric or Marie, do you want to jump in, because this is what you're doing on a daily basis? Is there anything else you would like to add?
Do you want to go, Marie? Or?
Like, I suppose really, like, we based on job preference, so what the person wants to do. So I would never like pigeonhole someone into a certain area. Like, you know, I think every individual has their own style, has their own preference. You know, they know what they want to do, and it's just about reaching that. Like, I would never go, oh, this is what you should do because of this reason. You know, for me, I think it's a personal preference, really. So I would agree with John there. I think everyone has their own aims and ambitions, and that's what they want to achieve. And I suppose that's what we try to do, is to guide them to achieve that, really.
Yeah.
Anything you want to add, Eric?
Yeah, I suppose just for myself, the only thing I always come back to with IPS is the idea that it instills hope in people. And I think that comes back to what John was saying. There are lots of people who've kind of maybe given up on employment or feel like it's just not going to happen for them again. And I don't think you can underestimate the power of someone coming in saying, no, we completely believe in you. We can see everything that you're capable of doing. And I think that's a real powerful message for people to go, do you know what, actually, I can give this another go.
Yeah, no, that's a wonderful message, Eric. There's other comments that have come in that are mainly just saying it's great to hear the passion and about the program, and just looking at the chats, yeah, about kind of, you know, people are kind of saying that mental health isn't necessarily related to intellectual capacity, and we need to meet people where they are. But just maybe kind of going back to something that was raised in Jeanne's presentation around, you know, she spoke a bit about stigma, and, you know, I put a question to her around, you know, she was speaking a lot about the value of kind of having diverse workplaces and about valuing people of all backgrounds, you know, of all kind of capabilities. But how do you find, you know, John, at the national level, and then Marie and Eric, that with, you know, is there a lot of misconception still there? And what can we do? You know, what's your advice for, you know, how we can ensure that we're really, that the whole recovery model, which is something we're all very passionate about and we know what it is, not everyone understands it, and how can we, you know, is there any creative ways you think we can get that message out more? I think this webinar has been one of those ways, but yeah, just to hear your thoughts on that, and maybe to finish up on it.
For me, it's about talking. Simple as that. We all have a voice, and I think the success of where I'm working in the National Office of Engagement and Recovery is that we are now not dealing with consultants. We are now talking to the people who affect change, which is our service users and our family members, and we're asking their opinion. And this is why the IPS has been important, because they've told us the two key things that they want as part of their recovery is they want independent living and they want employment. They want someplace comfortable to live, and they want someplace to go during the day. That's what they want, and we're starting to hear that voice. And what we've done is we have embedded the IPS into our community mental health teams, which means they're part of that conversation. And our job is to go out and listen to it and then facilitate it. That's all we have to do. And that's done through conversations like this. It's done through interdepartmental networks. You talked about working with the Department of Social Protection. We've met with those. We're chipping away at that block to make sure that this doesn't just become a HSE initiative. This is about across society. So they need to see the benefit of what's happening here, because the more people that we get in through IPS, it means that we're taking one person off the door. It means that we don't need to go and visit our community mental health teams as often. We don't have to go to the doctor. We're giving people meaning. And it's about that listening, not talking, listening to what people have to say to us.
Yeah, I fully agree, John. And I think what IPS shows, it's, you know, mental health, it's not just a health issue, it concerns every single government department, and they need to realise that as well. Marie and Eric, any thoughts there?
I suppose from like my perspective, like on the ground level of like destigmatizing, there's like, it's a two-pronged approach. So you're working with the client with what they're comfortable with and what they would like discuss when it's relating to like discussing with employers or employer engagement. So I suppose one question I would often ask is, you know, if they're kind of saying, oh, I don't want to disclose, you know, like obviously it's up to the person's choice. I go, would you like to work with an employer who stigmatizes you? You know, do you want to work in that kind of workplace? And actually put that onus back on them, that you have a choice here, you know, that why would you want to work for someone who won't respect that or give you that space to be? And I suppose the second prong of what we do is with the employer engagement is we, like, I suppose, advocate with employers. We kind of get the message out there with them and we try to make those connections. So I suppose that's really, I think, what our role is within that. Maybe Eric, you'd have something else to add, I don't know, or maybe there's something I'm missing.
Yeah, look, I suppose from my own perspective, it feels like we're very much kind of on the ground, day to day, sort of, I suppose, implementing IPS. And I just think in very simple terms, every interaction we have with anyone, it's an opportunity to sort of change a mind or to advertise why IPS is so effective, why it works so well, and whether that's with clients, whether it's with employers. And we have a huge role in terms of just sort of disseminating our message, which is that, you know, people with mental health difficulties have a huge amount to offer, and they've demonstrated that through their resilience and their ability to manage what they've been through. They're characteristics that any employer should be looking for, and I suppose we have a big role in terms of just spreading that message with every interaction we have day to day.
Yeah, that's a brilliant message to end things on, Eric. I think, you know, this is everyone has and should be given the opportunity to contribute, and I'm blown away by all the work that you're doing down in Cork. And yeah, just to thank you all for what's been a truly engaging webinar. And this webinar it is being recorded, so, you know, please feel free to use it as a tool. I think for anyone listening, it's been just a comprehensive argument to why we need to continue to invest in IPS and these types of programs. So I'm just going to hand over to Amy quickly before we end, just to tell you about the conversation next week and to inform you about the survey. But thank you to all our speakers.
Thank you.
Thanks.
Yeah, thanks, Fiona, and thanks to all our speakers. I can't thank you enough for your honesty, insights and your experience, and those that shared their lived experience. Thank you. And thank you to you for attending. So yeah, I shared a survey in the chat there. Feel free to give us your feedback, and then join us next week where we're going to be looking at women's mental health and specifically how that has been impacted during COVID-19. And you can follow us on social media. We'll be posting about that over the next week and how you can register. So thanks everyone, and I'll let everyone go and enjoy their lunch.
Thank you.
Thank
Bye-bye.
you. Thanks, bye.